Thank you for joining us with Therapy Chat, Phoenix Behavioral Health. I'm Dr. Dawn Parks, and with me is Christine Delorier, LICSW, and LADEC, a substance abuse specialist. And today we are going to be talking about some questions that seem to come up very frequently. And we've put together probably 6 or 7 of the more common ones. So today we're going to be talking about those and giving our own experiences with those questions and how we handle those in session. One of the first ones that comes up, question that always comes up, how can I become more motivated? That there are things that I want to perhaps achieve, there's goals I have, and whether it's in the work arena or in relationships or in pastimes, hobbies, I just have a hard time getting going and getting that motivation going. So is that something that you see often, and how do you deal with that?
I actually had that exact situation just last week. And this was a person that had actually been on a pretty good run with being motivated and had incorporated a lot of healthy activities into her life and had gotten derailed from it due to a family situation, and then was finding herself unable to get back on track and get motivated again. And one of the things that I suggested was that she break it down into small stages. And oftentimes I think what I find with patients is that they hold themselves to a very perfectionistic standard, and they demand a very high level of compliance or achievement on their own part. And it's almost a little bit unrealistic. So we broke it down into stages, and instead of, for example, working out 5 days a week, work out twice a week. And then if she's able to do that, she's going to feel successful. And once you feel successful, you start, that in itself creates motivation. And then you can increase it. And that way you're not, it's more of a realistic expectation, and you're able to meet it, and you feel better about yourself, and then you can tackle more things. So that's kind of how I try to get people back on track motivation-wise to take on something.
Yeah, it kind of ties in with what we've talked about with goal setting, breaking it down so it's something that's doable and it's more of a possibility, it's more realistic. So, getting motivated about doing the 5K when I haven't even started running is difficult, right? So let's see if I can run for 3 minutes without stopping. That's my first goal. And so now, because it's something that's potentially much more doable, I can start getting excited about it and getting motivated about it. And then I can build on, well, what about 5 minutes? What about 10 minutes? I think another thing that's really helpful is having some kind of a reward system. And again, as with all our clients, we kind of tailor, whatever those needs are to that individual. So a reward system may be something that for one client, they can think of 5 rewards right now, right? And so when I meet the first part of my goal, reward number 1 comes in, and reward number 2 at the second part. Another way I like to do it, though, is to have the client write down, either in session or during the week, 5 or 10 things that they feel would be rewards for themselves. Sometimes very small things, like my special favorite cappuccino, right? Or it might be going to a movie or to a play. So all different types of rewards, whatever suits the individual. And then I'll say, write them on a little piece of paper, put them in a box or a little bag. And then when you achieve the first step of the goal that you're working toward, just kind of close your eyes and pull one out. You're guaranteed it's something you like because you wrote it, but you also have that little bit of an element of surprise because it's one of 10 possibilities. So that can be kind of fun as well to do that. But I think having the rewards, the reinforcers are really powerful, and also visualization. You know, so if there's something that I've been wanting to do, but I've kind of held off from it, if I can really have some kind of an image of myself doing it, and doing it in a fun way or in a successful way, that can kind of trigger motivation too. When I see people who come in saying, you know, I really want to work on my diet, it's not the greatest, right? Or I'm not sure what we can do for dinner this week. Just getting a healthy recipe book and just looking through. And at first you're probably not that interested, not that hungry, but when you go through all the pages, you're like, oh, I want to do that, oh, that will be interesting. So it kind of sparks that motivation as well to get involved, to get engaged. Okay, so let's see, the next one. Another one comes up a lot. How do I stop negative thinking?
That one's hard, because you usually, when you're in a pattern like that, it's been in a pattern for years.
Yeah.
You've been doing the negative thinking probably since childhood.
Yeah.
So it's very hard to reorient the brain on that. I think the first step is to recognize that you're doing it. And once you become conscious of it, then you can start working on thought stopping, derailing it. But it takes a while.
Yeah. It does. And the first step, really important step, awareness, right? Because it's become a habit and I might not even be aware, right? So I'm seeing the world, say I'm a very anxious person, I'm seeing the world and everything that is happening and every interaction I have and every situation that comes up through the lens of anxiety, and that's what I always do. So the first step is to start to develop a little bit more awareness of how am I seeing this and how else could I look at it, could I look at the situation. And another tool that can be helpful is just distracting, and this isn't necessarily negative thinking, but this could be racing thoughts, right? And not being able to focus on what's going on. It's kind of like a grounding technique that we can use. And if we look at graphic 1, we can see some of the elements of that 5-part list. So on a grounding technique, we'd say, what are 5 things I see? And I know we mentioned this a little bit in mindfulness that we talked about a few months ago. But 5 things that I see in this moment, and not just notice that I see them, but actually put a name to them. So I'm starting to get my mind unstuck by naming what I'm seeing in the room. 4 things that I'm hearing in the room. If it's a quiet room, it might be a challenge, but I can make some noise, tap my fingers, right? Sound of my breathing, right? Sound of, sometimes I can go past the room and what do I hear outside? Cars passing by, doors closing, the heating on, the air conditioner. 3 things that I can touch. Sometimes touch can be bring you right back into the moment. 2 things I can smell, and then 1 thing I can taste. Just remembering that can pull me away from my negative thinking in that moment and kind of neutralize things a little bit more. And also what we're trying to do is to retrain our mind to separate that judgment or that negativity that we're giving to our thoughts, what often is referred to as cognitive diffusion. So there are some techniques for doing that as well. And graphic 2 talks a little bit about cognitive diffusion. So really what that means is standing back from our thoughts. And I know a lot of times when I'm working with a client, it's very easy to feel that I am my thoughts, right? So this is never going to work out, I'm not going to be able to do it. And I believe that because it's my thought or my feeling that goes with it, which might be anxiety or depressive thoughts. So I want to be able to stand back and notice the thought without getting involved in it. It gives me a little bit of distance, a little bit of maneuverability in that. So on our graphic, I put in a few examples that are others. One of the things that we can do is what's called a pop-up mind, where those on the internet, those little pop-up ads that come up, we practice closing it. Except I just noticed that thought there, right? Doesn't mean that it's true. It doesn't mean I have to respond to it. Or I could choose to respond to it later, but not right now. Passenger on the bus. So we're imagining that we're driving a bus and we have some really annoying or difficult passengers, right? But we want to keep driving the bus. We don't want to have an accident, right? So we're aware of them, but we want to stay focused on what we're doing in the moment. A third one is saying that negative thought slowly. It gives an element of empowerment because especially if you have a racing thought, right, or repetitive thought. So saying the thought slowly gives a little bit more empowerment to the whole thing. You can slow it down. Sometimes imagining or visualizing that thought being written on a leaf, and then you drop the leaf into the water, to the stream, and it just floats away, and we don't jump onto it and get carried down the stream with it. We just notice it, but we stay grounded in the moment. Thanking the mind, right? Sometimes a thought will come up and we say, okay, thanks for the thought. I don't need it right now. Or it might be good. I might look at it later. Kind of like the first one that we'd said. Also, it may not be on the graphic, but using humor. Noticing the way I'm thinking, right? I know I tend to catastrophize, and now I'm in a situation and I can notice myself doing that, and I can kind of use some humor to say, oh, you're doing that again, right? And it brings me back to neutral. And sometimes carrying a card with the issue or the worry or the thought on the card, showing that you can carry it without it controlling your life, you know. So, and there's a lot of other things too that can be used, but these are probably some of the more common and easier to do techniques. Another one I hear: how can I improve my well-being and mental health? And we often get into, it can be a big part of the conversation because, we're talking about mental health and, that mind-body connection. So it often does involve physical health as well, and how we can do that. And if we think of, again, there's a lot of things, but 4 main areas that we can focus on. Focus on HEPAS, HEPAS, healthy eating, physical activity, and sleep. Because if one of those is lacking, it really impacts the other, right? And, you don't get enough sleep, that can ruin your day, your activity level, your motivational level. If you don't eat healthy, it impacts your thinking and your mood, your physical well-being, and without the physical activity, that affects everything too. So important too when we're talking especially at a time like now with everyone being so much more stressed and anxious, so many things that we have no control over. So the way we eat and our activity level and our sleep care is something that we can control, and so it's very empowering, right? Which is really important.
I think some of those, what you just mentioned about the healthy eating and the sleeping and the exercise is, I mean, it's important for everyone, but it's especially important when you're in recovery from substance abuse. Those are key things. Eating healthy, sleeping, those are all the things that are upside down when you've been in active addiction, and it takes a while to right those things in recovery. And oftentimes when you get sober, all that other stuff is still upside down, and that affects your feeling good about your recovery, and often can destabilize you and possibly be a contributing factor to picking up again.
Absolutely. Very, very important. And it's almost like this is the base. If I don't have a good foundation, a good base, then it's really hard to move up, right, and do the things that I would like to do, or the things I need to do. Another thing is making time to do something that is meaningful, right? Because I can come up with a list of things that I have to do or I should do, but there's no time to do the things I want to do for no particular reason, just because I want to do them. So really making that a priority too, even if it's just for 20 minutes, right? But finding something that I just really enjoy doing and having that time to relax and refuel is an important thing. Third thing, having a sense of control, achievements, or independence is important. So starting something new, starting something that requires my focus to be taken away from the mundane, everyday things that I can get used to and that can actually become habitual, don't require as much thinking, because just like driving a car, right? When you learn to drive a car, it's a big experience because you're thinking of everything, and now you're driving the car and it's second nature. So, looking at what's going on in my life now, when was the last time I actually learned something completely new that really requires all of my focus and energy, and it's very refreshing. It's almost like a mental vacation, because although I'm still busy, I'm busy doing something that's very different, and I have to be more engaged and more mindful. And it's very good for my cognitive and my emotional parts of my brain. And then the fourth part, expressing gratitude and appreciation. So this is something that we may have talked about too, but we have what are called depleting emotions and replenishing emotions. So depleting emotions are emotions like anger, frustration, sadness, jealousy, what we might classify as negative emotions. So they literally are depleting because they draw away from your energy system, and so they end up affecting you depending on the individual. Some people will feel it in a physical sense, even though they've not done a lot physically. After a very emotional day, they may feel exhausted physically as well. And other people will feel it more perhaps in their thinking. I'm not able to think clearly, or my mind's racing, those kinds of things. And then you have replenishing emotions, which are emotions like gratitude and appreciation. So even being able to sit for just a few minutes, even 5 minutes, some point in the day, and to hold a feeling of appreciation and gratitude, it kind of resets everything, and you find that your energy level comes up physically as well as mentally and emotionally. So, next question.
Sure.
Okay. Next one. How do I stop procrastinating? Do you hear that much?
Well, that kind of ties into, I think, to the first question about being motivated, a little bit tying into that. And I mean, I think I would use some similar techniques with that in terms of the motivation one, because I think with procrastinating, it's really about feeling overwhelmed and just not wanting to deal with something because you're either overwhelmed or it's triggering perhaps a feeling inside of you, whether it be sadness, anger, something, anxiety, and so you don't want to look at it.
And that's a good point, because so many times when someone comes in with an issue of procrastination, they feel, or people around them say that it's because they're very lazy, or they have bad time management, and then they feel guilty and all of this other negative stuff that builds on it, where we're really dealing with more of an emotional issue. And that procrastination, what's happening with that, right? Is it self-sabotaging? Is it because some feeling comes up that's really challenging? So it's not so much we have to look at the procrastination, but more the feelings that are running behind it and what's happening with that. And of course, the negative thinking patterns that come with that as well. So it's quite a big thing.
Yeah, you can get very down on yourself for being a procrastinator, and that's where again the negative self-talk can come in.
Exactly.
And then that just makes you feel more depressed and more not like you don't want to deal with something. Kind of a fun question I get sometimes from people is, how do you remember everything from session to session? And
I get it.
And you know, the reality is, I think, you know, we're trained, and part of the reason that we took this job is we're generally interested in people and what they're experiencing. So we are generally interested in listening on that level, and we're also trained. And so for myself, I have a good memory, I guess. I'm just fortunate in that respect, and I do pay very good attention, and I do remember from session to session what we've talked about, and it just comes more naturally for me, and I am able to pick up where we left off, basically, and so it isn't difficult. And on occasion, I think, you know, especially if I've only met a person once, I might not quite have gotten in sync with them, and so I may need to review a note or something, just because I've only seen them once and I'm just not quite sure that I had everything correct. But once I've gotten in the rhythm of seeing someone a couple times, it's very natural.
And I think it's also that if you're able to focus, you know, it comes into communications and listening, and when you were really listening to the other person, it enables that capturing of the data, capturing of the information, so it gets written in there, right? So when you have your cue, which is the person coming in, or their face, or their name, it triggers the whole cascade of everything else. From being in the moment, you know. That's a big thing. And when you look back at it, actually it's a lot of information. It's a lot of information, because all of, you know, the person sitting there, and all of a sudden you remember they have 4 children, and the ages of the children, and the names, and the school, and everything.
But I think that's it's important
Yeah.
to know that, because
It is.
this person is sharing some very intimate, valuable information with you, and you should be paying attention and
Yeah.
you should be remembering. And I think that's, I genuinely care about my patients, so I care about what they're telling me, and I try to retain most of it. Now, every once in a while I forget something, but for
Yeah.
the most part, I pretty much, it's important for me to honor them by remembering too.
Absolutely. Yeah. And, there were a few other questions we just don't have time to finish, but perhaps in another session we can go through those. But we have to wrap up now.
Okay.
And thank you for joining us today. And if you have any questions, you'd like more information, have any ideas, thoughts of things that you would like us to discuss in Therapy Chat, then you could contact us on our website at phoenixinfo.online or call 508-623-3931. Thank you.